Hey there, everybody. I'm Eric Osberg. I'm the Rural Rebound Initiative Coordinator for Otter Tail County, Minnesota. And we're back with another Rural by Choice career conversation. And joining me now is Susan Marco. Susan is with TriCounty Healthcare, and she is the provider recruiter and in charge of provider retention. And I'm sure you wear many, many, many hats, Susan. So thanks for taking some time to chat this morning.
Yes, I'm excited about this, and you guys are doing a great job out there with Rural by Choice. I love that.
Well, thank you. We appreciate that. Um, So let's talk about Tri-County Healthcare.
Yeah.
Your job is to recruit providers there. What is your sales pitch to providers? What do you tell folks when they're considering a career there? Why should somebody work at Tri-County Healthcare?
Well, I think it's interesting. First of all, we are an independent organization, and that is rare in this world today of the big corporate healthcare entities. So we're independent. So that means that our physicians are on decision-making boards. So imagine that physicians making decisions about medical things. So imagine that for a minute. And so we really, independence is very important. We've been in existence almost 100 years, and we just keep on going, keep on growing. I also talk to providers really since COVID. The whole world has changed in a way. And one of the things I think a lot of people, not just providers, kind of came to a philosophical reset during this whole thing. And that is, I can live anywhere. I need to look at the quality of life. So if you think about, as an old English teacher here, Hamlet, to be or not to be, really it's how to be. How can we be in this world? And so a lot of doctors are very interested in coming up to this area because we have hunting, we have fishing, we have water sports of all types and sizes. They really love the bike trails up here. And also, we have good schools and it's safe. And this is a very safe place to be. So, those are a lot of the big things that people are looking at. They're looking at that work life balance, and working in a rural area can give you that. Plus, I think you'll find this interesting, Eric, from the point of rural by choice. Physicians have realized that they can have a better financial lifestyle in a rural area, and that's made a huge difference.
It's not necessarily how much you make; it's how much it costs you to live in a place. And
Yes.
we've done research, and this is old research, so it's not completely applicable to this conversation. But ballparkish, you can live for 64 cents on the dollar when you look at rural
Yeah,
Otter Tail County, anyways, versus the Twin Cities metro area. So,
exactly.
just to keep the math simple, if it's $100,000 salary, well, you can have the same
Yeah,
quality of life at around us, and go ahead and raise it to 75%. But still,
yeah,
it's
yeah,
exactly right.
yeah.
It's not how much you make; it's how much you keep. So, talking about Tri County Healthcare, there's a lot of exciting things happening at Tri County. If
Huh.
providers are looking for the latest and greatest in technology and tools and equipment, you guys are building a brand new facility just on the eastern border of Otter Tail County. Tell us
Yes.
about the transition in that project of the move from Tri County Healthcare to Astera Health.
I think it's part of, in order to really be competitive and everything, you have to be innovative. And I think that's what we've done here. I mean, we look at our past, and then, but more importantly, we look to our future and what can the future hold. For instance, in certain parts of our old building, it was fine back in the day when you had hospitals with a lot of beds. But nowadays, almost everything is kind of that in and out, and people aren't spending days upon days in the hospital. Same thing with women having babies. You're not spending a week in the hospital. And so I'm really excited about it. One of the biggest things I'm excited about is that we have these new OB birthing suites. And it really is going to be fantastic. And we actually have something up on our website where people can go and they can actually be a part of the tour and see kind of the new birthing suites. And we also have a new OBGYN that will be joining us, a young physician, female physician, will be joining us in next summer, so of 2023. So we're excited about that. And I think it's just going to be a really great time. I look at what's been done in our surgery areas. Our orthopedic surgery has just boomed. We are so fortunate to have Dr. Ben Robertson here. He really is, I don't know if people realize he's one of the top orthopedic surgeons in the Midwest. And I just look at all the things that we're doing, and I'm so proud of it because I choose to go to TriCounty Healthcare, and that's where and in fact, the orthopedic surgeon will be seeing me in a couple weeks here. Um, so I'm doing my part too, and I just look at it, and I'm so happy with what we're doing and where we're going, and the innovations that are taking place.
And so that when does all this transition again? Your current location is in Wadena, and then the new
Mhm.
location is going to be on Highway 10. So and the
Yes.
name is going to change. When do we anticipate all this change happening or
Well,
becoming completed?
we can hope for a good spring for weather because we're doing this in March of 2023. I mean, if you drive past it today, you see the building, everything. It's kind of the final details are going down, but we have our whole month of March kind of getting ready. I mean, can you imagine that kind of move? I've moved before and I thought, oh my gosh, I have a lot of junk. But can you imagine moving a whole hospital, all the equipment, technology, that sort of thing? And towards the end of March will be official start date of patients going there to the new location.
Well, and you brought up the new provider that's coming on staff in the
Yep.
summer. I was able to meet her and her husband
Yes.
at your Starlight Gala that you had, and it was neat because her husband and we talked fishing the whole time, right?
Yes.
He's a big angler, and that was part of the draw. I mean, you
Yes.
you know who would have thought that fishing would be a way to recruit workforce, but I'm
Yes.
saying that's why they're moving here, but it's
Yeah.
part of the piece. It's a piece of the puzzle anyways.
Yeah. You know what was so interesting about that? Her husband said to me, he said, um, to me and to our new provider, he said, you are going to be safe here and they're going to care about you. And I just was my heart just burst at that moment because it's true. We take care of each other and I can't even wait for the community to meet her. They're just going to love her.
Well, is there anything else that you think is important that people need to know about Tri-County Healthcare or working there or the transition to Astera Health? Anything else that you want to make sure people know?
Well, first of all, I mean, this just blows my mind every time I kind of try to wrap my head around this. Do you know that we have 450 employees? That is a huge employer. I mean, look at all that has been accomplished in the past couple years, especially with kind of everything in our world being turned upside down. And I just am so proud of the fact that we were able to go ahead and able to build this and we're hiring. We're in the process of hiring. I can't tell you all of my little secrets right now, Eric, but we're hiring many more providers. I mean, people are really going to have some options. We just hired, in fact, a second midwife. We're seeing our midwifery program really grow as well, and that's something I love the choices. And the thing is that it's also a learning process for me because when we first hired our first midwife, Dawn Remick, she taught me so much about what she could do. I'm past the childbearing years, knock on wood here, and but I mean, what she can do for women's health has been amazing, and she's somebody that I go to. So I mean, it's just I feel like there's so many options for people now, whereas back in the day, you really didn't have all those options.
Well, we appreciate you and your staff keeping our communities healthy and safe, and appreciate the work that you do. I know that you're out
Mhm.
there beating the bushes. You kind of cover the country sometimes,
Yes, yes.
trying to find the best providers you can. So we appreciate your efforts. And so if somebody wants to learn more about Tri-County from an employment standpoint, is there where should they go online? Where could they go to get more information?
Well, they can go to our website and they'll see a career button. Push the career button, and it's going to show you. We're actually hiring for a lot of different things right now. It's a great place to work. It really, I love it. This is the best job I've ever had, and so I'm so happy to be here. But one thing also is I want to tell your listeners, if they're not looking for a job and they want to do some volunteer work, we're in the process of kind of relaunching our volunteer program now with kind of COVID subsiding. And I'm trying to talk to somebody at the local high school who a lot of the seniors do volunteer work, but we need people in our new hospital just to be somebody that can help move people from, let's say they go from X-ray. Okay, you need to go down this hallway. So if you want to be a part of that new building, we've got some great volunteer opportunities. Even if you say, I can only volunteer like an hour here or there, man, we could use it. We need volunteers of all ages, all backgrounds. We could really use you guys. So stay tuned. That's going to be hitting our website pretty soon and our new launch of that.
All right. Well, no, we'll make sure to try to help
Yeah.
get that word out too. So, Susan, thank you so much for taking time to chat, and best of luck in the future, and keep up the good work.
Yes, well, thank you. And thank you to Eric and Ottertail. You guys are really, honestly, a big draw for us. And I told Eric this before we started talking that my husband is not impressed much, but he's impressed with me that I know the infamous Eric Osberg because my husband is a fishing maniac. And Eric's got quite the good reputation out there. We're very lucky to have you in our area. So,
Well, I appreciate that, Susan. I'm just happy to be on the team, and hopefully I can help. So, thank you very
yes,
much again, and we'll
yes.
talk again soon.
Okay, take care, Eric. Thank you.
Okay.